How is Parkinson's disease more than just a movement disorder? Parkinson's disease is more than just a movement problem. We think of it as having sort of those four main features. That would be the tremor, the slowing down, stiffness, and trouble with walking and balance. But there are many other features of Parkinson's disease. Sometimes they even come on before the movement part. About 30% of people with Parkinson's have some depression, and anxiety can go along with that too. Depression it's more than just sort of feeling sad or down about Parkinson's and the symptoms of it, although that can compound things. But in a depression, somebody is feeling sad or down for most of the day for many days in a row, usually a few weeks in a row. That's a clinical depression. And along with it, a lot of things can be affected, like sleep and appetite, concentration, and sometimes there are even hallucinations or delusions that go along with that, usually kind of negative ones. Depression is treatable, and so is anxiety, but it's important to be very cautious and use medications slowly and carefully in someone who's living with Parkinson's so that we don't exacerbate any of the other symptoms of the condition. But it is treatable, so it's important to screen for depression and talk to your doctor about it. The cognitive part of things is a bit more complex. There are some types of dementia that look a lot like Parkinson's disease, like dementia with Lewy bodies, but that's usually pretty easy to tell apart from Parkinson's. There's Parkinson's-related mild cognitive impairment, which occurs in up to 40% of people with Parkinson's. And there's Parkinson's-related dementia. In Parkinson's-related dementia, the cognitive or thinking changes kind of get in the way of day-to-day life, whereas in mild cognitive impairment, they don't. The person notices changes in memory, but it doesn't actually interfere with managing life. So if your doctor is looking after your Parkinson's disease, they probably want to check in with how your thinking and memory is going periodically, just to screen for those changes, the mild cognitive impairment or the Parkinson's-related dementia. The autonomic nervous system controls a lot of the automatic functions of the human body, like breathing and heart rate, sexual function, urination, things like that. The autonomic nervous system can be affected in Parkinson's, so people can get fluctuations in blood pressure, especially when they change position. This can cause dizziness and make someone more likely to fall down. It can also cause things like erectile dysfunction and trouble with sexual function in other ways, like achieving an orgasm. There's also challenges with constipation. Constipation can be a really common symptom in Parkinson's disease. Thankfully, a lot of those symptoms can be treated with medications or with other measures like paying attention to diet or restricting other medications that might be making the situation worse. But it's really important to tell your doctor about that if you're living with Parkinson's. You might not think that the symptoms you're experiencing are part of the Parkinson's, but they could be. So it's a good idea to bring them up and see if you can work on a solution. So Parkinson's disease is more than just a movement disorder, although certainly the movement, or we sometimes call them motor symptoms, are pretty important and they can really get in the way of day-to-day function. There can be a lot to adjust to with the diagnosis of Parkinson's. But a lot of the non-motor features can respond to the treatments that we use for the motor features as well. So for example, we always recommend exercise and getting out and socializing as a way to help treat some of the features of Parkinson's disease.